My name is Motley. I'm the program manager for Elm City Communities Department of Community and Economic Development. And we welcome you here to Constance Baker Motley. We are very fortunate and excited through Mayor Tony N. Hart to partner with Cornell Scott Hill Health Center for this very essential diabetes screening pilot program made possible by the Philip Merritt Trust Fund and the Bank of America N.A. Ladies and gentlemen, without further ado, the Honorable Mayor Tony M. Hart.
Thank you very much, and good afternoon to everybody. I am so delighted to be back at Constance Baker Motley Apartments, named after a woman who is a role model to so many of us who are in public life. I am delighted to be among all of you for today's announcement of this innovative, collaborative program. I want to thank all of you for your interest in better health for New Haven residents, and thank you for your efforts to put this program together. There is no understating the value of partnership as this program is launched. The Philip Merritt Trust Fund and Bank of America generously provide funding necessary to underwrite the screening and medical treatment specific to diabetes. The Cornell Scott Hill Health Center, my former employee, and the city's health department provide the medical expertise. And the Housing Authority provides access to its property and its residents. Just as they say, a chain is only as strong as its weakest link, this partnership is strong because each of its components has gone out of its way to make it strong. And all of this is to combat the scourge of diabetes, a disease said to afflict nearly 30 million Americans, while an estimated 86 million more have a condition known as prediabetes. What's more, the Centers for Disease Control and Prevention estimate that 90% of those with prediabetes don't even know they have an increased risk. Complications from diabetes can lead to further difficulties with eyesight, kidney function, heart disease, stroke, and circulation disorders. So it's imperative for everyone to know if they have diabetes or at a risk for developing it. This innovative project program run by the Cornell Scott Hill Health Center and the Housing Authority of New Haven and the city's health department, again, partnerships, delivers education and awareness programs as well as screening services directly to residents to promote prevention, early detection, and early treatment if necessary. These national statistics highlight the local urgency of this new program. Like any chronic condition or disease, diabetes is easier to treat earlier, so that justifies an accelerated screening program. Like many chronic conditions and diseases, diabetes can often be prevented, so that explains the awareness and education component of this program. I'm extremely grateful to the grant providers and all the partners in this diabetes education and management program. And I'm extremely proud of the fact that New Haven is its home. We have, I think, some of the most collaborative people willing to engage in partnerships, probably, I know, in the state, but perhaps even in the United States. And some of our partners are here. And Alder Brian Wingate, raise your hand, everybody, give him a round of applause. And Alder Delphine Clyburn. And, you know, you're going to be hearing from more of my staff, but I really want to thank Martha Okafor, and I want to thank Medalia Castro for really thinking about what could be done in this particular apartment for people who have diabetes or pre-diabetes and other kinds of programs. And I thank the Bank of America as well. And now it's really important to add the partner who's going to put the feet on this program. And that's my former boss. Believe it or not, yes, I used to have a boss. The CEO of Cornell Scott Hill Health Center, Michael Taylor.
Thank you, Mayor Hart. It's wonderful to see you again. What a happy occasion. It is the mission of the Cornell Scott Hill Health Center to improve the lives of those we come in contact with, our patient population, and we couldn't be more delighted to make yet another step towards moving closer to that mission, by partnering with the Housing Authority, the City Department of Health, and many others to bring this service to the residents of Constance Baker Motley. We are absolutely thrilled. Interestingly enough, when Dr. Okafor brought the notion to us that she and the mayor had been in discussion about what we might do to arrest the debilitating prospects of diabetes, I said to Martha, well, we already have an answer for you, and we've been working on it for some time now. So many thanks to the Bank of America and to the Trust for allowing us to bring the infrastructure that we've been developing for, I think, 3 years now to the residents of Constance Baker Motley. We are just delighted to be here, and we look forward to keeping you all well.
Well, I'm going to do this. First of all, you know what? I forgot. Whenever you start pointing people out, you forget to introduce certain people. So Martha Okafor is the Community Services Administrator. She's going to speak in a few minutes. Give her a round of applause. And our Health Director is this really handsome guy over here with the glasses. That's Dr. Byron Kennedy. So give him a round of applause. Our next speakers are going to be our alders. And so, Brian, would you like to speak? Brian Wingate.
I just would like to thank all entities that put this together, all parties. Diabetes is such a long history of, dilapidating our community. I also was diagnosed with type 2 diabetes, and I lost about 2 pounds to help me out. But I was on metformin and different, kind of medicines that really helped me out through the process. So anyone who has this disease, you can fight it. You can beat this if you listen to the doctors, if you listen to the healthcare providers in the back that can drive you to a successful recovery. Thank you so much.
And our next alder is Delphine Clyburn. Come on and just say hello.
Thank you, everyone. Thank you, Mayor Hart. Just thank everyone today that is here today that is caring for our residents. I also had a family member with diabetes. I watched toes be removed, different parts of the body. So it's very important that we start now and stay together, remind each other, and work with each other to make sure that we stay healthy and that and stay strong. So thank everyone today. Cornell Scott, thank the Bank of America, thank Ms. Okafor, thank you. We just thank everyone, the president of Cornell Scott too. We just want to say thank you for loving on us. Thank you.
Well, good afternoon. So I am so happy to be here. As many people have said, this is really an exciting moment. My name is Martha Okafor. When the mayor came in and said, what could we do to look at diabetes, especially with our, seniors and older population, I couldn't do anything more but to reach out to other people. So the first thing we did was to really come in and try to talk with some of the seniors about what it meant to live with diabetes, and to have a little bit of understanding about what it meant, not only to lose maybe a limb, but what else happened when you lost a limb? What else, what are the pain or the suffering and things you couldn't do that happens to you because you lost a limb? And after listening to that story, there was no doubt in my mind that we have to take an action. So the next thing we did was reach out to Cornell Scott, and as Michael explained, he was very delighted to work with us. And if you look at the plan that was put together, one is he was delighted, Housing Authority was delighted, however, we didn't have any money. So Migdalia, I reached out to Migdalia, and Migdalia said maybe we could do something with Merit Fund, but it wasn't meant to actually fund these kinds of services. So we went on the call with our partner, and by the time we had the conversation on the call, she was open for us to actually put together a proposal. So it takes a village is really what you see, is people caring about each other, but having a leader that is really compassionate makes it easier. Once Carmen, who is representing Bank of America, said to us she is open, it led us to conversation. We brought in health department, and I told some of the stories I heard from the 3 people from this unit. I'm not going to mention their names, who told their stories to me. And once I told your stories, we began to look at what will it take to really do this program. So you others will talk about it, but it's not only health services, which Cornell Scott will present to you. There will be a curriculum that we're going to develop to help seniors that live in this unit to be able to continue to work on promoting wellness among each other. So it's not just the health services, the medical care, but it's also your lifestyle, which some of you, we hope, will be willing to be that ambassador and coach for your peers, because it takes your everyday conversation you have or when you're walking to really help each other out, so that all together we can make a difference. And the last thing that will happen in this program is that we want to hear more of your stories, because many people do not understand what it means to live and to suffer and to really go through and thrive and overcome diabetes. So that will be the last part of this, because your stories will help all of us to do things better and to do things differently. So I will allow us to speak to what we will do. But thank you so much.
Good afternoon. Kennedy from the Health Department for the City of New Haven. I'm delighted to be here. I guess first want to put a shout out, I guess maybe to the mayor, because really this collaboration is the brainchild of your vision. I'm hearing that when the mayor was doing some of her initial, if you will, community outreach, and then recognizing that she encountered maybe many seniors, including maybe some in this particular facility, who had actually had diabetes, and that impacted them or someone that they loved. And then knowing maybe further that some of those impacts were devastating, including some folks unfortunately having amputations and other complications of diabetes. And so that really maybe started, if you will, maybe the genesis of what can be done to address this and what can be done to hopefully maybe prevent this. And I will tell you that when we look across maybe the country, this is really an issue nationwide, and it's not necessarily maybe something that somebody has figured out what to do about it. We know that in diabetes, that about 10% of the population suffers from it, and yet we know that being folks who are seniors, their rate is more than twice that. We also know that African Americans and Latinos in particular are more likely maybe to suffer from diabetes, and particularly the complications. So when you actually figure the fact that folks who are seniors, folks who are African American, Latino, and then you actually maybe throw into that maybe folks who are low income, that synergistically maybe increasing maybe the risk of them not only having diabetes, but having serious consequences from that. And yet I can tell you, looking at the literature, and I had looked at this with more depth a while back, when I was here in New Haven previously, but was surprised maybe to learn, looking even more recently, how much we still have not learned from this. And so one of the reasons why maybe this project, is so incredible, beyond maybe the partnerships, which are fabulous, but it will give us maybe the opportunity to learn more about this, to learn more from you, and what you teach us will actually be valuable not only to your community here, but it'll be valuable maybe to other communities, not only here in New Haven, but throughout the state, and in fact, I would say nationwide. Most of the information that we know about diabetic complications is extrapolated from middle-aged adults. Why? Because you just simply don't have the studies that have been conducted that look at senior citizens, who are in these circumstances, and get that data directly to actually make decisions or to think about what to do to prevent. So we're hoping that, while this is a really good starting point, we certainly are thinking that this won't be the end, and that it will actually maybe guide a lot of the ongoing work, not only in this community, but in other communities as well. And so I'm very excited maybe to be joining, rolling up my sleeves to work with others, and not the least of which, I'm hearing from Adelia Castro, who heads our elderly services for the city of New Haven.
Sometimes you come in front of podiums and there's so many things you're thinking to say, but I thank God first because you gave me an opportunity to be able to be at this important role, and so I just wanted to acknowledge my co-trustee Carmen, and she's here with me, and as you know, the Philip Moret Fund Trust is composed of the Bank of America and the partnership with New Haven Department of Elderly Services, and we were able to help. And so we gratitude to Philip Moret that we are able to help in the time of need. So with no further ado, just to say that sponsoring this fund for this in a perfect timing program to support this program, it's excellent, and I join you in the celebration because help is on the way.
Okay, so with this, we want to invite Mr. James Pittman, one of the residents, to please come up and speak with us.
Thank you all for being a part of my life here at Constant Motley. I have type 2 diabetes. I have high blood pressure. I'm 68 years of age. It has been a struggle for me because I was in a scooter accident, which I have a rod in my left leg, so I try to ride a bicycle a lot to equal off the weight that I apply. And I have hunger pains, so that adds to my diabetes because I gain weight. And I don't all the time eat the best of food, the healthiest food. But with this wellness organization that came in, it gave me a direction in order to go about the way I eat and the amount of food that I eat. They are teaching us how to eat the proper food that's most nutrients for our body, and that will scale down the diabetes increase of growth within our, because we are elderly, we have to understand this, and it's we want to grow in grace as we age. We don't want diabetes to be a way of discomfort in our way of growing, but I'm stage fright, so y'all know. but I feel good about myself. And like I said again, I'm glad for Bank of America for being part of this. And I'm pretty sure that other organizations in time will step on board and be a part of this because we so definitely need it. And we thank each and every one of y'all for being a part of it again. And that's all I have to say on the subject. I appreciate it. Thank you.
So I don't know if everyone would come up with partners. Do you have any questions, Paul? Or any of the other?
Yeah, tell me a food that a lot of people are eating, that you're getting them to eat something else instead.
So I'm going to direct that question to our provider on site, who's been working interactively with the residents here. Natalie, this is Natalie.
Come on up.
I have stage fright also.
Come on, we'll hold you up.
All right, so, nice to meet everyone who I haven't met before. I'm Natalie. I'm part of the Wellness Education Program. I have all of my staff in the back, and I thank them for being a big part of this. We've had a great experience coming in here and working with everybody. So the question specifically was about food changes. There are many things that can be changed. One of the main things that we talk about frequently is sugary beverages. Diabetes is a problem with sugar, and that's something that we don't even notice in our lives often. So it's finding hidden sugars in the foods we eat, decreasing the amount of sodas and juices and things like that. Sugar's everywhere.
Is there something specific that you've seen people drink or eat a lot of here that now they're eating and drinking less of and having a substitute? Do you think of a specific,
Here specifically.
kind of specific food or
Do you
drink?
want to comment that? So Mary Angel is one of our nutritionists and has been working directly with folks in that regard.
That's a really good question. Sorry. Everybody. But I think that's a question that will be pertaining to many of the folks who are resident here, that we've been coming each time with a new agenda, new tools, right? So you can share on that. What have you changed? What have you noticed? That's a good thing to add up. You were commenting, right? So today's topic, what did we talk about? Basically, we talked about how to read that a food label, right?
Yeah.
Exactly. So how to really, make a change between deciding product A between product B, besides the number, how much it costs, right?
Yeah.
Reading more into it. So it's just little building blocks where they can take action and have control in what they put into your diet.
I think that's it.
Okay.
Thank you.
Thank you all very much.